going on, Tamika?
Hey, welcome to Urban Renal Talk with Tamika.
And Steve. I missed that intro. I love that intro. What's going on? Nothing much. How you doing, babe?
I'm well. I'm so excited for today's show. Yes.
Oh man, you hit another home run out the park. And share this broadcast, y'all. First of all, Good evening. Good evening to everyone. Thank you for watching. If you're watching globally, thank you for tuning in. This is a great show tonight. Tamika, tell us about your guest. It's going to be awesome.
Yes. So once again, we have another international guest because kidney disease is just not in America. It's all across the globe. So tonight we have from Kathmandu, Nepal. We have, I can't pronounce his name, Steve. I don't want to mess it up.
Shamsher.
Dr. Arshan. Yes, Steve said yes.
Oh, absolutely.
He's all the way from Kathmandu, Nepal.
And that's way across.
On the other side, yes.
That's on the other side of the world. My God.
Yes, he's been in the field for 15 years, but within the last 5 years, he became a doctor.
Awesome.
It's so awesome. Just when you guys hear the difference between over there and here, it's, oh my goodness.
It's probably like night and day.
Yes, it is. So before we get started the show, Steve, talk about Kibo, and then I'm going to talk about this book here.
Absolutely. Hey, y'all. First of all, I'd like to thank our sponsor, Kibo Health, the makers of Renal Diet, which is a dietary supplement with pre and probiotics. However, this is an FDA disclaimer. This product hasn't been verified or looked at by the FDA. However, this also is not intended to diagnose, treat, cure, or prevent any diseases.
No.
However, many people have taken this and have great results. Again, it's a prebiotic, probiotic dietary supplement that help maintain healthy kidney function. So we have the website going across the screen. If you want to do your research to know about it, please feel free to do so. And if you do decide to reach out and you like it, we have a code that's going across the ticker. If you order, add that code in and you'll get a discount. So what's going on with that book, Tamika? Dr. Dr. Rowe was good.
Remember Dr.
Rosansky, right.
He showed this book. So I actually purchased this book. Let me tell you, this book has so much information on it, and it will help you. It will help you. It will help you. It will help you. I've educated my patients on so much information, things that I didn't even know, like the reason to stop smoking. I'm telling them to stop smoking thinking it's about their lungs, but no, atherosclerosis. It is so deep. This book is really good. It was $13. It's something every patient should have and just peruse through while you're on a machine. Highlight. If you used to look at my book, I done highlighted so much stuff that I'm telling my patients and talking to my patients about, especially my new patients as they're coming in, having different conversations with them to help them have longer life on this machine and actually know what's going on. So.
Oh, that's awesome. That's awesome that you took the time out. No, that's awesome that you took the time out to buy that book and to share with your patients at the unit. That is so awesome.
Steve, let me tell you, every doctor that came past, I said, have you heard of this book? You need to get this book. Read this book. There's the medical students that was coming past because we are a teaching hospital where I work at. So even there, I told the students, y'all need to get this book because even with me having 22 years in the field, I learned so much information.
Yeah, we should at least get 1% from those sales.
Something. And it's just, you know what, this stuff.
You know what I'm saying? Become affiliate marketer.
But you know what? Even if we don't, Steve, if we can just educate people and people able to educate themselves and help themselves stay a little more healthier, it's all worth it. Because when I say this book have gems in it, this book have gems in it. All right, let's go.
Sure. All right.
Roll.
All right, let's bring the drum roll for Dr. Shamsha. Guys, share this broadcast because you're not going to, let me just say this. You're not going to see anywhere else a live broadcast from a show overseas with a nephrologist talking to you. You know, this ain't the Kidney Foundation and nothing like that where it's all framed up. This is live. This is in stereo. This is in living color. You're not going to get this nowhere else other than Urban Health Outreach Media. So share this broadcast. I guarantee you.
Yes. And disclaimer, we have nothing against the National Kidney Foundation. We just are doing things differently. Right, Steve? Yes.
Absolutely.
Okay,
absolutely. We're doing the new normal of kidney disease education. This is the new black of kidney disease education. Here we go.
That's right.
Hey, Doc, how you doing?
Well,
Hey.
I'm very good. Namaste from Nepal.
Thank you for coming all the way from Nepal. Wow.
It's my pleasure.
Thank you. What time is it there?
It's 7 a.m. right now.
Friday morning.
Friday morning, 7 a.m.
Wow. Do you have to make rounds today or go see patients on dialysis?
Yeah, definitely. I'll be leaving around 8 a.m.
Okay.
About 8 a.m. So we're gonna just keep them. We're not gonna keep them long, Steve. Okay.
Right.
Okay.
So tell us about dialysis in Kathmandu. Do they do reuse of the filters?
Dialyzer. Yeah, first, everyone, hi, hello. This is Dr. Archan Shamsher Rana. I'm a nephrologist from Nepal. So I'm here in this field for around 15 years, but I have got my license in nephrology for last 5 years. And I really want to thank Steve and Tamika. I think I pronounced it right or wrong. I'm so sorry. So
Okay.
both of you, thank you very much of having me here. So basically, dialysis in Nepal, recently it has started recently, 15, 20 years back. So last 5 years, it has grown up the number of patients have grown up very high because the government has given it a free dialysis right now in Nepal. So the number of patients have raised very high. So definitely about Steve asking about the reuse of the dialyzer. Definitely we reuse dialyzer from around 5 times to around 20 times also. Even seeing the patency of the dialyzer, we reuse it.
Wow. Oh, we used to do reuse here in the United States, so they no longer do it here. Now, let me just ask you.
Yeah.
Do you feel from your medical opinion that reuse is medically beneficial?
So there is 2 schools of thought in reusing dialyzer machine. I mean dialyzer. And there is 2 schools of thought. So some people say because of the reaction and all, the reusing is better. But we are from Nepal, and because of the economic status also, economic condition also, I think reusing is right now it is okay. Better. I can't say it's better than using one time, but right now it is stable, it is okay, because seeing the complication to the patient, we can't find any complications, so everything is going okay. So I think I'll go with using dialyzer. Reuse is better, I think so, in our part of the world.
Okay. How many times do they reuse that dialyzer?
So we use it around 4 to 5 times usually. 4 to 5
That's not
times.
Yeah.
bad. Okay. That's not
You
bad.
know, Dr. Shumsha, here in the United States, I actually worked at it facility. It was a DaVita unit. I'm not sure if you heard of that company
Yeah,
here
yeah.
in the United States.
I've heard it that. Devita, yeah.
Yeah.
I know that.
Well, I worked at a place where they used to reuse dialyzers up to like 60 and 70 times.
So actually using, we have a machine out here. So with that reprocesses, as you all know, reprocesses. If the patency is above 80%, then we can reuse it. So here also we have used some dialyzer around 20 times also. So it is, but on the average, it is around 4 to 5 times.
Okay.
Wow. And you say that dialysis is free and transplant is free as well, right?
Yeah.
So,
Wow.
I mean, people who's watching this right now that's on the transplant, because here in the United States, there's more than 100,000 people on the transplant list. And they have to worry about not only because Medicare pays 80% and the patient is responsible for the other 20, but not only that, they got to worry about medication, which Medicare only covers up to 36 months or 3 years. Is it the same way in Nepal? How long do they cover the anti-rejection medication?
Actually, the how many years I can't say exactly how many years they cover, but they give a certain lump sum of money. So depending upon that, it will continue. Actually, the date, how much duration of time that I can't exactly say, because this transplant, the free process and everything, it's been around 4 to 5 years that we have doing it very in number of time. Before, in a month there used to be 1 or 2 transplant, but right now every week we have 2 or 3 transplant right now.
Wow.
Oh, wow. Okay. And what is the leading cause of kidney disease over there where you're at?
Yeah, before that I want to say everyone, because of this corona covid, the pandemic
Sure.
going on, first I want to just add this one,
Please share that.
if I have please everyone stay safe, stay healthy, because the transplant right now are for around 5-6 months we have stopped right now because of the pandemic and all. So the main cause of CKD dialysis patient is glomerulonephritis out here in Nepal. Still, it is glomerulonephritis, as in the textbook, and even in United States, the main cause is diabetes and hypertension. But here in Nepal, it is still glomerulonephritis, which can be prevented and treated if it is recognized early. So, me, Dr. Archon, and with my team, we have started an initiative. It is called Swastha Mirgola Swastha Jivan Abhiyan, which is Healthy Kidney, Healthy Life Initiative. So what we do, we go to schools, colleges, and all the clubs and gatherings or gatherings. So we educated people. Excuse me. We educated people. We give them awareness about kidney disease prevention and all. We do screening test also, screening, so that we can find out what is the cause. So what is difference out here, that we don't have any health insurance. We don't have here, the people here don't actually go, they do this yearly checkups and regular checkups. We don't do usually. Maximum people out in Nepal, they don't do it, because as the geographical changes in Nepal, so we have from 8,848 meter high to around 50 meters, means the range. Nepal is a small country with geographical means changes. It has the highest peak in the world, Mount Everest, that is 8,848, till the lowland is around 50 meters in the span of only is not a big space. So to reach each and every part of the country, it is very difficult. So to reach some part, we have to work 2 to 3 days. So our initiative for last 3-4 years, we are doing this initiative. So we have traveled to the remote areas of Nepal also to spread awareness, and where the patient can't come to the hospital, so we are taking hospitals to the patient, or to the community itself, small
Wow.
community itself,
Mm.
so that so that we can improve the burden of the kidney disease and all.
That is
Mm.
awesome. You taking it to the
Mm.
community.
Yeah.
Yes, walking 2 to 3 days. That's noble. Oh my goodness.
So, Dr. Shamsher, what is tell us the average dose of treatment that the average patient get, meaning
Yeah.
3
So
hours of
no,
blood
I'll
flow rate, dialysate flow rate. Tell us the normal prescription for a patient.
So here, the actual, hemodialysis, the maintenance hemodialysis is around 12 hours per week. But here, we give around 4 hours, 4 hours twice, that is 8 hours a week in average. To average community everywhere, we actually prescribe around 8 hours. But some, seeing the condition and seeing the patient, we prescribe around 12 hours. So basically, maximum average people gets 8 hours per week with the blood flow of 300 to 300.
Now, what kind of KT over V and URR are you achieving with that type of prescription?
So basically, giving 8 hours will definitely not be ideal. So the KTV is little bit reduced, or URR it is reduced out here. So, but basically, as I said, the number of machines out in Nepal is little bit less to compare, because last 4 5 years the government is giving it free. So number of people before, around 4 5 years, what used to happen, the patient who are diagnosed with kidney disease and who are supposed to be in dialysis, they used to stop everything and go back home to wait and wait. So now what happened, every kidney disease, even in a kidney disease, renal biopsy, even government is providing them some amount. So from that is some amount for treatment. And in for dialysis, it is free. If you do twice a week, it is free. If you do 4 times a week, it is free. So what
Mm.
people, number of people have increased because of the capacity, number of the people, and the limited numbers of the dialysis centers and machines. The number have been reduced to 8 hours ideally. 8 hours on average.
Wow.
Wow. So what machines do you guys have there?
So in Nepal, 80% of the machines are Fresenius machines. So some are Nipros, Brown,
Mhm.
I know about
and
Braun.
Mhm.
yeah, those.
Do you
So
do you take donated machines?
no. In initial years, which I remember around 20 years back, when the private dialysis and all have started. So at that time, the some donated machines were used. But right now, the government have strictly said that no second-hand machines are allowed in
Okay.
Nepal. So donation is from the through the government. So there are so many private institute like me myself. I'm working in Mark International Kidney Center, which is a private institute. So we are actually there is no donations out here.
Uh-huh.
Only
So,
government.
Dr. Shamsha, tell us about, if you know, about the technician and the nurse training. In Nepal, do they use dialysis technician, or do they use nurses, or they use a mixture of both?
Actually, in Nepal, it's little bit different than which you usually study in a book or you see in other countries. Where I went to conference and all, I met some dialysis technician, and their portfolio out in Nepal is little different. So we have two, one technicians and dialysis nurse. Both are there. So technician only basically see all the machines and the water treatment plant, where dialysis nurse only deals with the AV fistula and all the blood process. So when I went to India sometime back, they said that they have different. They have a technician who, dialysis technician who does AV picking also, even everything they do it there. So in our part, it is little different. So technician only deals with the machines and the water purification and everything, and dialysis nurse only care about the patient.
Okay.
Yes. So, Dr. Sumter, we're going to respect your time because we know that you have rounds at 8 o'clock. We just wanted you just if there's anything you want to tell them about kidney disease, or just how to protect themselves, or anything that you want them to know, and then maybe you could come back on another time, and we will adjust to your time.
I think no. We can continue till 8. I have taken a. We can continue after 8 also. Don't worry.
Okay.
Oh, awesome.
Okay, good. Good. Yeah, we just wanted to respect your time with the patients and rounds, and we didn't want to not have the patients get care, So, okay, cool. All right.
That's great. That's great. So, Dr. Shamsher, how prevalent is glomerular nephritis in Nepal? I mean, is that something that, well, let me rephrase this. Where does kidney disease fall on the top 10 list in your country? Or is it on the top 10 list of the leading causes of death in your country?
It is in top 3.
Oh my God.
Yeah, it is in top 3.
Wow.
Right now, glomerular nephritis, as you both, Steve and Tamika, when you see a dialysis patient in your center, I think maximum age, average age is, what is your average age of dialysis patient in the United States?
Maybe about 60, something like that, 65.
Yeah. So sorry to say, it is below 30, 40, 50 to 60% of dialysis patients in Nepal are below 30, 40. I mean,
wow.
That is the age. So when the age is 30 to 40, I mean, average, that can't be because of the diabetes. That can't be because of, can't be, I can't say can't be, but it is less likely because of diabetes and less likely because of hypertension. So the main cause of kidney failure, kidney disease out here is glomerular nephritis. Excluding some genetic disorders and some congenital disorders, maximum people of young age are because of glomerular nephritis. This point has been the main point that I have initiated this initiative. So why our dialysis patients are only 30 years, 40 years, even around 9 to 10 months back, a 19-year-old boy came to me with all the signs and symptoms, and his creatine level was around 16. So so we did emergency dialysis and all. So he said he had no symptoms, no sign and symptoms, nothing at all. But why my kidney are damaged? He had such a big question mark in his face. So that those things are there. So because why they say that? Because as I said earlier, we don't have any insurance. We don't have any regular checkup. People out here don't do regular checkups and all. So this my initiative was to reach out to them and ask them to, because even a simple urine test, even a simple urine test can see show proteinuria, and the patient will be suffering, is suffering from glomerular nephritis or something. We can check out that. So what I have started is to do, we have only 4 or 5 things to do. What do we do? We do GRBS, means random blood sugar test, the glucometer. Then we do urine dipstick. We take pressure, and we take a history of any, some alcohol, drugs, family history, everything, and we take BMI. We only do this thing. These 5 things we do first. So all the patient, when we go to camps right now, this because of the corona, we are unable to do those things. Before that, when we go for camps for screening tests, and around thousands to 2,000 people come. So doing those things, screening everything.
Wait a minute. I'm sorry to interrupt. When you said you do screens, you said thousands of people come?
Yeah, definitely. Thousands of people.
Wow.
So is there a lot of education?
Wow.
No, I didn't get you. Tamika?
I said, I'm sorry. I said, is there a lot of education that make the people come? Because here, trying to have a kidney
Yeah.
screen, you're not going to get thousands of people. If
Yeah,
you
and
get,
we need to do marketing, and what we do is wherever we go, whichever community we go there, we try to contact the local club or institute or something like that, which is involving who are doing their social work in those areas. So we try to contact
Mm,
them, and through them, these numbers will, because the small societies out there, they, when you contact everyone, then the numbers will increase.
Wow. Now,
thank
Dr. Shamsha, let me ask you, we had an interesting question from a gentleman named Manny Philibot who has kidney disease,
Yeah, yeah.
and he's been on dialysis 29 to 30 years on
Mm.
hemodialysis. Now, with that being said, what's the mortality rate of patients on hemodialysis in Nepal? Do you have patients that that are on dialysis more than 20 years, or that's unheard of in Nepal?
No. We have patient. Who are doing dialysis for 20 years. Yeah, definitely we have. I did my master's degree in Bangladesh, which is also in Asia. So there, I had a patient who are doing dialysis for 36 years.
Wow.
you.
Yeah, in Nepal, there was one female. I think she's no more right now. She was doing dialysis for around 20 years. 20 years.
Wow. So
Wow.
Yeah.
Tamika, Doctor, I'm glad we had you on, because if you didn't share that information, I would have thought that it wouldn't have been a long, the mortality rate would have probably been high because of maybe lack of technology. But that just shows how ignorant I am about international medicine, because we here in the United States, we only probably see different pictures of what's actually really going on in the renal community off of Facebook. So we don't actually get that opportunity to talk to people like professionals like yourself, to see what it's actually like there. So thank you for sharing that with us.
You're welcome. Yeah.
Tamika, what you
So I have a
think?
question.
Wow.
Is there home
Yeah.
hemo there? You guys do have
No,
home hemo?
home hemo actually we don't, because as I said, dialysis is free. Dialysis is free only in the institute. In dialysis center only it is free. But some people, I have seen that 2 or 3 people doing home hemodialysis, which is very expensive, and not only expensive because of the money, because of the technicians and everything, because of those problems also. I think here in Nepal we don't promote home hemodialysis.
Well, let me just
What about
ask you.
PD? Go ahead. That's Steve.
Now, go ahead, CAPD. Go ahead, Tamika. I ask
Yeah.
after that.
I
Yes.
was gonna you do PD?
Yeah.
Peritoneal
CAPD. Yeah,
dialysis?
definitely. Yeah, peritoneal dialysis. We definitely promote peritoneal dialysis, especially peritoneal dialysis. As hemodialysis is free, peritoneal dialysis, the fluid is also free out here. So usually, as I said, because of the geographical changes in Nepal, so people from the remote areas, we advise them for peritoneal dialysis. But infection rate, the infection rate is very high. So before initiating peritoneal dialysis, the education, everything, not only to the patient, to the patient party also, it's very tough out here, to educate it and to tell them that this is peritoneal dialysis is better for you, for your community, for you where you stay. You look, but it's very difficult. But around 2-3 years, the peritoneal dialysis is also coming up.
Mm-hmm. So Dr. Schuster, let me just ask you a question.
Yeah.
We know that the more dialysis, the better, right? And you mentioned that patients normally in Nepal get about 8 hours a week. With that being said, is there a difference in class? And what I mean by that, do mostly people that are well established with a higher income, are they able to do home dialysis and daily dialysis to get that quality of life opposed to the average person in Nepal that may be getting it free?
No, no. The picture is different out here, because even even everyone here gets free dialysis. Even the Bill Gates of Nepal get free dialysis. Even everyone gets free dialysis. So as you said, bit higher the number of dialysis, the better the outcome. I don't actually go with that. I said 12 hours per week is ideal. That is known. But
Wow.
seeing the picture of 8 hours per week for last 5-6 years, because the outcome, it is okay.
What do you
I
think
mean, we
about that,
can.
Tamika? I mean,
This is
that's a stark contrast from the United States, where, like here in the United States, which you probably know, Doc, that they want individuals to have at least the standard 1.2 or greater KT over V, and then 60% or greater
You are.
URR.
Mhm.
So even with, sorry to say that, even with 8 hours per week, we maintain 1.2. We can maintain, not to every people, but maximum numbers, around 50% of the people maintain with KTV by 1.2, or you are at 60% or above.
Wow. Wow. Very interesting.
Wow. So what about kidney failure in children, infants? What is the procedure for that?
Yeah, no, we have pediatric nephrologist and all everything, but to the limited institute only we have pediatric nephrologist and people treating with children. So all the children suffering from kidney disease and all, we refer them to a certain institute where it is taken care of.
Mhm.
So the number of children is also there. Children. So we have a pediatric nephrologist in Patan hospitals. I mean, some government hospital out here where they are taken care of.
Mhm.
That is different branch.
Oh, awesome. Now, Doc, what
Yeah.
is the rate of polycystic kidney disease in Nepal?
So there is a one group of people that have started PKD Nepal. That is polycystic kidney disease in Nepal. So exact number data is not collected right now, but within a year or two, you will be getting the actual number of PKD. So the number of PKD in Nepal is high. Definitely is high, because I don't know, because we are on average in a day, around, when you see around 50 patient in OPD patient, around 3 or 4 people with come with PKD. So the number is high. I don't know, because we are in tertiary center, so every kidney disease people come out here. So because of that, the number is high, or
Mhm.
it may be other reasons. So when you see around 50 to 60 patient per day, around 3 to 4 people with PKD definitely
Um,
knock you.
Now, one more question I got to ask Tamika.
Yeah,
Doc, what's the normal procedure for a transplant? And what I mean by that, does the
yeah.
patient get a pager and they get a call and then they go to the hospital? Is it normally somebody in Nepal goes and donate a kidney, or is normally
Yeah.
from a cadaver kidney? How does that process work? Take us through that.
So the transplant procedure in Nepal is very different. huh? So cadaveric transplantation have started around 2 years, 3 years back. We have started cadaveric transplant also, but still the belief out here is different. So even the people taking from cadaveric, they have some issues of those things also. So what we have transplantation is free, and is only for the family members. I want to repeat that again. Only to the family members and close relative, only it is free. No, you can't donate your patient to any random people. Only to the family members or your close ones, relatives. Second,
Wow.
we do have
Oh.
peer transplant
Exchange.
also. Yeah, exchange we do have, but it has to be in family with another. I mean, what I mean to say, you understood. Suppose family members has to be involved in that also.
Wow.
Wow.
This is very interesting.
Information
Yeah.
good. Wow.
Yeah.
Okay. So
Before,
at
before, yeah, I just want to add,
Sure.
around 5 years back, only the close family members were allowed. So now policies have changed that only other relatives, uncle, aunts, cousins, and all, they also can donate. Before it was only father, mother, daughter. So I mean, only the close relative was there. But 5 years back, we have changed. I mean, around 4 5 years back, the policies have been changed to the larger border community.
So,
That is.
so what you're saying is, if I was in Nepal and I
Hmm.
had kidney disease on dialysis, the only person before you changed it that could donate to me would have been my mom or dad. No one
Mom,
else.
dad, mom, dad, wife, son, daughter,
But that's
brother,
it.
sister. Yeah, brother, sister.
If
I mean, your
nobody
own.
and no one had that, if they was by themselves, then they'll be subject. They had to do dialysis for the rest of their life. Basically, what you're saying.
Yeah, that was around 5 years back. Now the number have your aunt, your cousin. The number of people have increased.
Wow. Is the list as high as it is
so
in the United States?
Not as high as United States, I think so. But
Uh,
still, as I said, it's family members and all. So still out here, the donation, wife giving to a husband is higher than husband giving to the wife.
mm,
I
The
can believe
donor
that.
number of female donor number is higher in Nepal.
wow.
I don't know the reason
Why
why,
do you,
but
the reason why? I don't know. Maybe women are more giving. What you
yeah.
think, Steve?
Yeah,
What you think?
absolutely.
Women are more
Well,
giving
well,
than
maybe
men?
let me ask you this. Maybe in Nepal, the husband is the breadwinner.
Maybe.
Could be.
So
Yeah, that may be.
maybe if the husband is sick, the wife may not can't go out and work. So maybe if she donates the kidney, then he can continue to work and I don't know, but that's very interesting.
What is the age limit on being able to donate an organ, a kidney? Okay.
It is 18 plus because legal age is 18. So if you are 18 plus, now the age has been increased to 21, but it's not still there. But 18, you have to be above 18, the legal age to donate a
Okay.
kidney.
Mhm.
All right. And
And
what is the
go ahead,
cap?
Tamika.
I'm sorry. What is the cap age? Like, what is the oldest you can be to donate a kidney?
I think it's 65.
Oh,
Wow.
good. Okay.
That's less because in the United States, I think it's 75.
I think now the new policy, as I have said, the age group that needs to be done because the data here, the average lifespan of a Nepali is 54.
Wow.
So, but as you
Wow.
know, but right now everything has been changed. So
Yeah.
even I don't know
$54.
how they collect data. So I have only 10 years left. I mean,
Right. But
so
that's really what is the number one cause of death?
hello.
Yes,
Yes.
can you hear me?
Yeah.
What's the number one cause of death in Nepal?
So number exactly is still it is diabetes and its complication. I'm going to the data. It is diabetes, cardiovascular. Cardiovascular cause is the most common cause out here right now.
Mm-hmm. Now let me ask you. We had a question from Dad Vice TV. He's on YouTube. This guy has over 90,000 subscribers, but he wants to know, when do patients typically start dialysis? Now, do you have like a certain GFR range when they start kidney
Yeah. Here, so actually going through the books it is little bit different here. We wait for the complication, and as I said you, the picture out here is very different, different than United States and other developed countries. So as I said you before, here you don't do regular checkups and all. The patient don't, they come to us, as I gave you example right now, that 19 years boy with no complication, nothing, no symptoms, no sign symptoms. He come with creatine of 16. So the picture is right this only, because when you develop symptoms, maximum people come here with symptomatic complications or any symptoms, they come here.
Gotcha.
So when you check, your creatine is high, in dialysis the GFR is below 10 and all. So first thing to do, first dialysis, if the patient is symptomatic or not. So a patient who is in regular checkup, so what do we do? Diabetes patient, we as usual, if the GFR is below 15, we hit for dialysis. If non-dialysis, non-diabetic patient, maximum we wait for the complications, if any complication is there, or if patient is feeling uneasy, or if the GFR is below 10.
Wow. Tamika, let me just ask one more question that's really interesting from Manny.
Okay.
No, it's from Manny. He wants to know what research is being done regarding artificial kidneys in Nepal. Are they doing any type of research for artificial kidneys?
No, not at all.
Or there go your question, Manny.
Yeah.
I mean, I was sure they're not that advanced.
Right.
So yeah.
Go ahead. Now, I just want to know, is there a special diet? We have the renal diet out here. Is there a diet where you guys are at?
Yeah, we do have diet, because nutrition is very, very important in dialysis. Because what I have noticed around 5-10 years back, patient with dialysis patient, they usually they collapse or they die because of malnutrition.
Right.
Because of malnutrition. Because here we have made that if you are a kidney patient, if you have some problem, don't do this, don't do that, don't eat this, don't eat that. So those are things that, so they are limited to even a little bit only. So their resources very less. Because of that, the nutrition is very low, malnutrited. They are very malnutrited. But last 5-10 years, what we have studied is there is a different branch in dialysis. Nutritionist. So they have started different form of nutrition policies. They have made a nutrition policy, nutrition strategy. They have some nutrition related things.
Mm-hmm.
So nutrition is played a very vital role out here.
Wow.
So we have a specific nutrition diet for dialysis patient, basically involving around their regular diet.
Right,
because as I have said that Nepal is very diverse, from 8,000 to 50 meters in height. So all the patients have different, some people prefer rice, some people prefer rotis and all. So they, along with that, the diet has been changed, or as per patient, the diet has been allotted or changed or prescribed.
Okay, I got one question from my from our watch party. Lady wants to know, in the United States, how is dialysis and transplant free? Where does the money come from for this?
From the taxes we pay, I think so. From the taxes we pay.
Wow. I mean, because it's not free here, so a lot of people who's watching tonight can't believe that, that the transplant and all that is free, where they get a bill from DaVita and Fresenius maybe every month for over $10,000, $15,000, $20,000.
Yeah, so the cost of transplant and cost for dialysis is little bit cheaper out here. I think it is 4 lakhs for transplant, which is around 4,000 to 4,500 USD.
Wow. Wow.
Sheesh. Okay.
Very great information. Do y'all use Epogen over there?
Yeah, definitely.
Okay.
Is the dosage different from the United States?
I don't know
Meaning,
exactly what doses you all use, but we prefer maximum erythropoietin. We use around here is around 4,000 twice weekly, and depending on the patient, it varies. Around 8,000 per week we use. From 4,000 to 8,000 we use, or sometimes we use dorbipotin, that is 25, 40, around those things.
wow. What about iron? I'm sorry,
Iron,
Tamika.
depending upon the iron profile we give profile. We basically doctors vary, but I personally prefer IV parental iron to oral.
Got you.
I just had a quick question. God darn it. Wait a second. Hold up. Wait. Oh man. Oh no. So when a patient albumin is low, do you guys give protein bars? What is your plan of action when a patient albumin is low?
So here, when albumin is low, so basically we give dietary. Diet is the main reason of low albumin. What I think. See. So what we prescribe is we give protein powders and all dietary supplements. Plus we ask them to eat eggs. Egg white, basically.
Wow.
Okay.
That's awesome.
Interesting.
Now, what is normally the patient staff ratio? Is it like one nurse or technician to 3 patients or to 4 patients?
No. It is like you'll be surprised to know that it is around 1:1 or 2:1.
What?
Wait a minute. So let me ask you this.
Because
What's the
because
normal size of the average clinic? Like 20, 30 chairs? Or is it smaller than that?
it's different. You don't have a huge number at center. You don't have a huge number. There's a lot of dialysis centers who runs around 5 to 10 machines.
Wow.
From those things, 5 to 10 machines. Some there are 2-3 institute who has 40 plus machines. In Nepal, around 40 plus machines. Only 2 institute has 40 plus machines in a center. In a single center. Even where I used to work, National Kidney Center, it has around 100 machines running in all over Nepal. But in a center, it has a 40 machines, and other it has 510. Because, as I said, the Nepal, the diversity and the geography is very difficult for person to roam around. So what we have done, we have reached to the different districts of Nepal, where remote areas. So there we have added around 4 to 5 dialysis machines, so they can do here home dialysis, home hemodialysis, and peritoneal dialysis. Very absolute, very few percent, less than 1% uses peritoneal dialysis out here in Nepal. So everyone prefers hemodialysis.
Wow. And now, do they have like 3 or 4 shifts? What's the average shift?
Yeah, sorry to say, the salary which the dialysis nurse, dialysis technician get here is around 1/10 of United States. So because of that, also it is very cheap manpower. So the number of has increased. I think that is my thought.
Wow. So how many shifts do you have?
We have 3 to 4 shifts per day.
Wow.
3 to 4. Okay. What time do the shifts usually start?
Usually starts for around 7. Dialysis they start around 7, and around 4 shifts they go around half an hour break in middle.
Okay.
And do they have TVs for the patient to watch while they get the treatment?
TV, free Wi-Fi, everything.
Wi-Fi, everything.
Air conditioning.
Machines, do they?
I didn't get you.
Do they have ice machines?
Ice machine.
Yeah, for patients to ice while they on the machine.
Yeah. We don't use, it's very cold out here. You don't use ice machine. We give
You know, okay,
water.
what's
Do y'all,
Okay.
do y'all allow patients to eat on the machine?
We do. Because the rule is not to eat.
What?
The rule is there not to eat.
Yeah.
But some people, it's like, so our there is a fast food momo. Momo is here very popular in Nepal, and that is dumpling, Chinese dumpling or something. It's very popular in Nepal. So dialysis patient what do you do? They prefer eating something that dumpling momos in during dialysis. So because of the psychological effect, also what we do is we just, because they have a psychological side to that. Okay? If they can eat momos and all, because of eating momos only, some people, I have 2 or 3 patients, they prefer dialysis. They want to come for dialysis only to eat momos.
What?
It sounds
Are you
very
serious? They want to
damn
come to
serious.
dialysis just for the momo?
Yeah, he's 16 years old guy.
Wow, that's an incentive.
16 years old guy.
So
Because in
Wow.
yeah,
wow, is the 16-year-old in the same unit as the 30-year-old patient, or as a 30-year-old patient?
yeah. I mean, below 14, it is in different. Yeah, above 14, it is in different.
Okay, all right.
Now, Doc, do y'all have patients that are non-compliant that don't come to dialysis and skip treatment?
Yeah, definitely.
Uh-huh.
That every each and every part of the world, they have those issues.
Right.
Yeah.
Wow. Wow, this is awesome. What do you think, Tamika?
Yeah,
We need to go to Nepal. We need to go to Nepal and do a show.
it's so interesting, like the same thing is being done but differently.
Yeah.
But the
Now,
same is happening.
yeah, absolutely. Now, are y'all being very precautious with COVID-19? What is what is going on over there with COVID and the protection of kidney patients?
No, we are the government has issued a strategy, everything, the rules and guideline. So we are following those things. We are following that too,
Right.
and luckily the rate of COVID in Nepal is little bit lesser than as
Wow.
expected, because we are close to China, and even India. We are in between China and India, so the number was supposed presumed to be increased and all, but it's very less. The death rate is out only 0.06, I think so, percent out here in Nepal. Around 55,000 people have been diagnosed with COVID, among which 360 or 370, exactly I forgot because I am telling the data of around 48 hours back data. I'm around 380 people have been dead. So coming to that, it is around only 0.06%.
Wow. Wow. This is very, very interesting.
Do you guys have face masks? Like, do you have enough face masks and sanitizer and stuff like that?
Yeah, no, we use proper PPE.
Okay.
Proper PPE.
That's good. That's good. There's no shortage or anything over there?
Now, initially, when they started that, there was shortage. Definitely, there was shortage. Very big shortage of, even with masks and everything. There was very big shortage. I'm talking about late January, around January and all. It was very. I'm sorry, not January. That is. We use Nepali date, so it's very confusing with the English calendar.
Okay.
That must be around mid-April or something like that. So it was very difficult during those days, because it was very difficult. Everything was locked down, so that was very difficult there. And even to run a dialysis was very high, because the consumables was very difficult to get, so everything was difficult. But right now, at present, a month or 2 month is very easy right now. So full proper PPE and everything.
Now, Doc, we had an interesting question. What is the grieving process? The grievance process, meaning if a patient doesn't like something at the facility, or say a technician or a nurse infiltrated a patient, or they didn't like something, what's the normal process for a patient to complain?
So we have complaint box is there. The information box and all. So is there. Even if they don't like the technician and all, one thing is to just be quiet, because if you are getting a free dialysis, you have to be quiet. Huh?
Oh, are you
Yeah.
serious?
No, second is, no, you definitely, even the consultant. So what the patient do is, they, when they visit a consultant, they just give their issues out there, and we have a complaint box. So they
Right. We know. We gotta understand. I mean, you're getting free treatment, so you shouldn't have nothing to complain about.
yeah.
Pretty much.
While
Wow.
maximum, so definitely they have a complaint. So the dialysis institute, dialysis center, which is there in Kathmandu, Pokhara, which are in the big cities, and the dialysis center, which I was talking about, in the remote areas, five machines and all, which are remote areas, which takes days to go there. So definitely the comparison between those two are very different, But what you do, you should be happy with what you have, Here,
Right.
our Nepali people, what they do, we have, because coming for dialysis, working for 2 days, taking a bus for 2 days, and doing a dialysis, and getting that opportunity in your own hometown is very different. That is very different. It's very, so dialysis coming up. So maximum people, what I feel, what I personally go there and talk, so they have less complaint and more of happiness.
So they're more grateful.
Yeah.
They're more
Right.
grateful.
Now, with the people that work, like the technicians or nurses, is there a high turnover rate, or are they like staying on their jobs for long periods of time because maybe the employment rate in Nepal? How's the
No,
turnover rate?
turnover is very high, As I mentioned earlier, you remember or not, the salary which the Nepali technicians, nurses get is 1/10 of the United States. So they
Oh.
prefer going there. They practice NCLX and all, and they just
Yes.
look for opportunity, because in the foreign countries, in then Nepal, the price and the respect and everything is very different.
Right.
Wow.
Right. Wow. This has
And
been
by the way,
awesome.
we don't have male nurses in Nepal.
What?
Really?
Only women?
Yeah, only female.
Wow. Is that like a cultural thing, or
I don't know. It's maybe because of that and all.
wow?
Wow.
Are y'all accepting international visitors?
Yeah, but I think here, Nepali nurses, we don't have male nurses, And I think so internationally also, Steve, if you come also, I think you don't get any job actually.
You can't get no job.
Right. No, we do. We often try to travel just to different states here in the United States. We haven't been out of the country just to shed light on kidney disease. So it would be come there to work, but just to
Yeah,
visit.
definitely. That will be a great opportunity.
Wow. That's so.
Well, Tamika, this been a great interview.
Thank you, Steve. We'll have to bundle up because it's cold here. So, Doc, we don't want to hold you any longer. We know that it's 8:00 where you are, and we know you have to do rounds. Yeah.
Can you hear us, Doc?
Yeah, I can hear you.
Yeah,
Okay.
we know it's 8:00 there, and we know you have to do rounds. We thank you so much for joining this broadcast and coming on.
Okay.
Oh,
Thank
Doc,
you.
one question.
Yeah.
What would you like people here in the United States to know about kidney disease and kidney failure from your perspective?
So kidney disease, the cause, everything out here in Nepal, in the United States is same. Some may go up, down. Some causes may be higher in United States. Some causes may be higher in Nepal. But the cause in the totality, it is same. So diabetes, hypertension, glomerular nephritis. As in the United States, diabetes, hypertension is the most common cause. So basically, you have to control your diabetes. You have to control your hypertension. That is the main cause. So you have to look after that first thing. Take your medications and everything. Consult your doctors regularly. So another thing, one is change your habit. So changing your habit, changing your perception to the disease is very, very, very important. So changing of habit is, what I mean to say is, do regular exercise. Please, no smoking, no alcohol, because they directly and indirectly definitely damages your kidney. So you have to avoid your alcohol, and the nutrition, the food what you eat, that is also you have to look after that thing. So nutrition, proper nutrition, proper diet, those are the main thing, and exercise and things you have to avoid. So regular checkup is very important, and regular taking medications regularly is very important. And in United States, what I have seen is mainly ADPKD, the genetic disorders. Those things are very high in those areas. So you have to counsel, genetic counseling, and those things also has to be done.
Oh, absolutely. Thank you so much, Dr. Schunzer. Would you be willing to come back at a later date just to share some more information?
Can I know the time?
Oh, yeah. Tamika would tell you.
Yeah. And we'll do it your time. Okay?
So my day have started, so I have a full day,
Okay.
So if you just give me a date, so I can just mangle up the time.
Okay. All right. Thank you so much, Doc.
Thank you, Steve. Thank you, Tamika. I think it was a very great opportunity for me to say some of my points out here. Hopefully you all enjoyed it.
Yes.
All right. Thank you. We enjoyed you being here. We're very honored to have you on Urban Renal Talk with Tamika and Steve.
Yes.
We see you soon, Doc. Take
Thank
care.
you so much.
All right.
Okay. Bye.
Bye-bye.
That
Tamika,
was
this
so
was a great show. Absolutely. Oh, Jays, I heard that moaning, right? I'm glad somebody else said it, because I thought I was hallucinating, right? I swear to you, I thought I was in The Shining, because I thought I was hallucinating like Jack Nicholas, and I was like, oh my God, am I really hallucinating hearing this? So I'm glad somebody said something.
I think that was the beeper going off.
Oh, okay. And Lisa gonna try to be funny talking about that's my stomach growling.
I think that was his beeper or pager, whatever they want to call it.
Yeah. Oh man, I'm glad, because I swear to you, I thought I was hallucinating, like the devil was in my head. I'm telling you guys, no, but mental health is real. And and I suffer from mental health from time to time. So I swear to you, I really thought I was losing my mind, and nobody else heard it. So, woo!
But this was a really awesome show. It showed kidney disease around the world is really no different from what you all go through here. Just different ways to do it, but the same thing is at the end. People are getting dialyzed, and
and the interesting thing about the cause of kidney disease there was glomerulonephritis, opposed to here is diabetes is the leading cause, followed up with hypertension. Very stark contrast in diagnosis.
Right, but Steve, remember in Australia, it's diabetes.
Yes.
So this is interesting. So I need to dig a little deeper through the
Very interesting. I wouldn't mind going to Nepal just to visit Dr. Schunzer and follow him around, just to see how nephrologists travel, you know, because like you said, it's really different, probably like night and day how they treat patients. And they use, and it was interesting to hear him talk about reuse. I mean, that was very interesting because we don't do reuse here in the United States anymore unless it's a private clinic. But I know Davida and Fresenius no longer practice reuse. But I'm glad that they only do 4 to 5, maybe no more than 6 usage of a reuse compared to what Davida and Fresenius, them guys, when Tamika and I back in the day when they were using reuse, they were, I know at least where I was working, 60, 70 times using one filter. Can you imagine that, guys? Imagine now you get a new filter each treatment, but imagine using the same filter up to 70 times, and they're charging the insurance company the same amount of money as if it was a new setup. You see how these companies do these back alley deals, and they don't do it no more. They give you a new kidney, but the point is they used to do it, and they did the practice for a long period of time. I mean, Tamika in 85 and 86, when I worked for Fresenius, which was BMA, they reused the arterial line and they used straight formaldehyde. It wasn't no cut. It was straight formaldehyde and embalming fluid to clean the filter.
I remember I was working in dialysis. I wasn't in 85 because I was a little young buck. But when I started in 98, they were still doing it over here. Yeah, I was a buck, like a buck.
Right. Yeah, we're going to definitely do that. My kidneys are my lifeline. Tamika's our international director of international guests. But yes. Huh?
No, I said director of international affairs.
Yeah, and they do have Fresenius and Davidas overseas, Lisa, and they use different machines. And I found out today from Snaziza, I hope I said your name right, but she's one of our supporters and followers over in United Kingdom, that they use something called hemodialifiltration. Have you heard of that? Not hemofiltration, but hemodialifiltration, Tamika, where it's a lot more better treatment over in Europe than it is in the United States. And I want to have to bring her on because I think she's in United Kingdom, and they just get a better treatment than the patients here in the United States.
Wow, that's interesting. I'm gonna find someone that does this so they can give us a little more education on that.
Absolutely.
It was really good.
Yeah, this was a great show. I really love you. I mean, I'm so proud of you.
What did we talk about before the show?
Yeah, right.
I may not be. Let me just hold up. Wait a second.
Oh my God.
wait. I may not be as active as you on social.
I know.
Wait, no. This is for the viewers too. I may not be as active as Steve on social media, but I am still in the streets raising awareness. I don't have to show what I do to do what I do. Thank you very much. That's for you too, Steve. Thank you. So don't.
Oh, I know that. You're a big part behind the scenes. I just like to acknowledge you because I don't see you on Facebook.
I don't need no acknowledgement.
Oh my God.
I know what I do. Thank you. Don't try to put me off the screen. Anywho.
Right.
Anyway.
Right. But yes, great show. We hope you guys continue to watch. You know, each week we're going to try to have a different guest. And next week, is it that the 24th?
Yes.
So we're going to have on, make sure you guys tune in on the 24th. We're going to have on Dr. Singh, vascular surgeon from Santa Barbara, California, from Chicago, that he's getting ready to launch his company, Fist Assist. that helps build veins up so you can get cannulated. He's going to be on next Thursday. This is going to be an awesome show. Vascular surgeon. If you got any questions about your access or anything like that, make sure you tune in on Urban Renal Talk with Tamika and Steve next Thursday at 9 p.m.
And thank you guys for the awesome engagement. Like, we really had an interesting night. We all learned a lot. It was really fun to see so many questions and people so in tune and wanting to know. I think having international guests makes us really curious about what's going on the other side of the globe. So I'll keep looking for people to come on that's out of the United States. And
Thank you, Tamika.
It also sets us apart from any other broadcast that goes on, not on our network, but on other networks, because no one is reaching out to someone across the globe to find out how are they coping and what are they doing. And maybe we can merge some of the technology or the information to make it truly work.
Absolutely. One thing I want to piggyback off of what you said. Now, that is very true, because whatever you may see what warriors may be doing over internationally that's helping them maintain a quality life.
Yes.
Maybe, I know everybody's different, but maybe you can try the same thing with your doctors. Talk to your doctor first before you try to modify or change anything. But if it's something that you don't need to talk to your doctors about, getting information on how other people are handling this disease, and as James said, kicking it to the curb. I mean, that is very important. It's very important because it gives you another outlet to see how someone else is dealing with this disease in a positive way.
Yes. So going to end the show tonight, guys. Thank you so much for joining us. Thank you for your support. Without you guys, we would be here arguing with each other.
Yeah. I love you to pieces.
I love you too, Steve. Okay. All right. I'm done.
You got the giggles tonight. What you have, Red Bull? Nah, I'm messing with you.
I had ginger ale.
Oh.
All right, guys. So thank you once again for joining us. Good night, and remember, your kidneys matter.
Absolutely. Thank you, guys. Peace.
Peace.